All right, it is time to answer some more questions from you. And let's see, I've got 3 questions here on the side effects that happen from going through treatment. This person says, I have terrible mouth sores. Is there anything that can help? All right, so one of the things that chemotherapy does is it attacks those fast-growing cells, and that includes the inner lining of your mouth. And your mouth can really get sore. And some people, it gets so severe that it's hard for them to even, eat and swallow. So I had some of this. There is something called Biotine. You can get it at the drugstore, and it's a mouthwash. And so I would constantly just go into the bathroom and just rinse my mouth out with it. And that tended to really help. You'll probably find when you're in treatment in your oncology center, they'll usually have some little, little cough drops, things you can suck on. If they get really bad, you can also use raw honey. One of my oncology nurses pointed this out to me, and I don't know the whole story of it, but I do know that it needs to be local raw honey, so from the bees in your area. But you can try that out. And also, I was about 3 chemo sessions in to my AC treatment, which is notoriously the rough one. Adriamycin does have that other name as red devil, and it's actually deep red in the tube that they bring you to. It doesn't just get hooked up by IV like all the rest of the treatments. It gets pushed right into one of the tubes that goes into you. And Adriamycin is the one that can really give you those mouth sores. And I learned, I complained after a couple of times that I was having the mouth sores, and my oncologist said, well, we have something we can do for you. Right before you get the Adriamycin, we're going to give you a little cup, and they gave me a little paper cup filled with ice chips. And they had me put the ice chips in my mouth and suck on them and really kind of freeze the inside of my mouth. And what that's doing is it's constricting the blood vessels so that when the Adriamycin goes flushing through your body, it isn't able to go to that lining on the inside of your mouth. You keep those ice chips in your mouth all the way through the push and for about another 5 minutes or so afterwards. And I can tell you, based on the fact that I had a couple doses without the chips, and then the other 2 doses I had with the chips, it's definitely a huge help. So if your oncology center doesn't know that little trick, you can be the one to teach them, all right? So just a little paper cup full of ice chips, 5 minutes before, all the way during the push, and 5 minutes after. Really helped a lot. Oh, here we have a needlephobic person. I can really identify with that. I've always been needlephobic. In fact, for years I had allergies, and I didn't go to the allergist just because I knew they were going to tell me I needed allergy shots. So what do? We just don't go. By the way, I finally went, and I finally got the allergy shots, and they totally helped. And it got me over my needlephobia a little bit. This person says, I hate needles, and I know you do too. Obviously, I've talked about this. How do you handle getting stuck in your arm every day? And would you recommend getting a port? All right. I had my first 2 treatments of Taxol through the arm. All I thought about for 24 hours before going there was not the chemo. It was the needle. And it just freaks me out completely. And of course I don't have easy veins to find. So it took several pokes. And I just thought, how am I going to do this? How am I going to have, 6 to 8 months of treatment like this, sticking needles in my arm all the time? I went back for the next treatment, and again, I just had them in my arm. I'm telling you, by 2 days after that second infusion, I looked like a drug addict. I had black and blue marks all over me. It was terrible, and they hurt. So I then had a friend say, oh, no, you shouldn't be doing this. It was someone who had gone through much worse cancer than I had. And they said, you have to get a port, because otherwise, besides the fact that you just hate the experience, you're going to blow out eventually all the veins in your arms. And he showed me his, and they were like big, hard lines all the way up the arm. And he said, you don't want to have that. So I called the next day and asked my oncologist, don't you think I should get a port? And they immediately scheduled me. And that, of course, is a little scary, because now you're going in for some minor surgery. And once again, they're going to have to put a needle in your arm, you know. So, but I did it, and it was so easy. I'm telling you. They told me I was going to be put under conscious sedation. It was the conscious part that had me concerned, of course. I said, no, I want to be completely out. And they said, trust us. You will be able to hear us, but you won't care. And that was a pretty good description. They rolled me in, and they do it under a big ultrasound machine, because they have to be able to look in and see where your veins are. And I will show you. I just have, see my little scar right here? They cut you about maybe a ½ an inch, and they insert the port right under the skin, and it has like a little opening, and then there's a little tiny tube, and the tube runs up under the skin, and then they make a tiny little incision up here, maybe a ½ of an inch, and that's where they put in the tube that actually goes right into one of your main veins, and then they hook them together, and they sew you back up. So every time you need your chemo, they just come over, and the end of the infusion tube, you know, it's one stick, it's very quick, and there's even some stuff that they can spray, topical anesthetic if you want. They can spray it with, it kind of like numbs the skin, and boom, you're in. No, it is so much easier. It also, just because of the fact of where it's located, and that it's going into that, you know, vein up there, it much more efficiently delivers the chemo to your body, as opposed to coming in through the arm and having to pump it up and around. So it delivers the chemotherapy in a better way. It literally changed my experience. From then on, I didn't freak out for 24 hours before I walked into that door to get my infusion. So I highly recommend a port. They do them in most hospitals. You're in and out. After you kind of come to a little bit, you're probably out of the hospital in 2, 3, 4 hours. Somebody does need to take you there, because you can't drive home. And I just had it taken out. I waited a while. They want to make sure that you're really completely done. I had to end up having a couple of blood transfusions throughout the course of my treatment, when my blood counts just got so low. And again, that made it so easy. Once again, they didn't have to go in through a vein in the arm and look for that stick. So I highly recommend getting a port. Just make sure that when you do, if you do, that you keep an eye on it. Make sure that it's doesn't show any signs of infection. That's the only thing that can possibly go wrong. And I don't know what it is, 1 in 100, but I mean, it's not a common thing. But you just want to make sure you keep an eye on it. And there are a lot of oncology centers that really don't even want to do the AC round these days without you having a port, because it's very, very toxic. So I'm really happy that I went that route, and I wised up, and I got a port. And I don't care. This is my warrior badge. If I have a little bit of a scar there, at least I did it the right way going through my chemo. Oh, this is a funny one. Is Chemo Brain a real thing? Did you experience this? Okay, so this is one of the things they don't talk about that much. They talk about the side effects that are obvious. Losing your hair, possibly losing fingernails or toenails. But this other side effect of how it affects you mentally and emotionally, and I mean on a long-term basis, they're starting to look at this more so that they can find ways to try to attack cancer without dousing us with chemotherapy that does have can have long-term effects. There are people that have the neuropathy, the tingling of the hands and feet, forever, and it's a really uncomfortable and problematic after effect. There are some of us, me included, that are always feeling cold, like getting the chills, and that's because it affects your nerve endings. And they really aren't sure completely how it affects your brain. There are concerns that it may bring on dementia, perhaps earlier than you would have otherwise experienced it. But there's definitely this like fog. My daughter, who was pregnant last year, she likened it to pregnancy brain. My husband says that it's kind of like, he said like living with me with chemo brain must be similar to what it's like for women to live with men who have selective memory and who, fall asleep with the clicker in their hand, and who you said, don't you remember you were supposed to pick up the kids today? And, you told them 3 times yesterday, but they just weren't listening. There's this sense that you don't hear things on the first go round, and maybe you just don't process them. Believe me, I'm blaming everything on Chemo Brain. I'm going to milk this one for some time to come. But before Chemo Brain, let me just talk about one other time that it's like wacko time. Right after you hear the words, you have cancer, there's this period of time, I guess the only thing I can call it is just kind of being in shock. If at all possible, have someone go to those beginning sessions with you when you're going through the initial discussions of what your cancer treatment is going to be and what your particular cancer is. Because I'm so thankful that I had, either my husband or one of my older daughters with me there taking notes, and then we would, enter them into a journal, because you're just not in the shape to be remembering and processing things at that point in time. So I highly recommend having someone with you. And do ask about not just the loss of hair. That's what we all focus on, losing our hair and losing our breasts. And okay, we all know that those are 2 things that can come with breast cancer, but do talk to your oncologist about all of the other lasting effects, and talk to your oncologist about the long-term effects on your heart when you have rounds of adriamycin, because they actually had me do a stress test before starting my AC round, where I was in the hospital and had me on a treadmill and had me wear a pack for 24 hours. They really tested my heart before starting the AC round. So there are concerns. So make sure you talk to your doctor about these.